I don't think it needs to, but it wouldn't hurt, I guess. It could be recording as well. Back up. Okay, so we're going to start with a little bit of foot massage in the prone position today. That's the official word for the face down position. And we've already got the product that the client enjoys. And I have a small cut on my right hand, and that's why I'm wearing a glove. And whenever you have to glove up because of a small cut, I think it's a good idea to talk to the client about it ahead of time and just let them know. And of course, you do not want to use latex gloves because a lot of people are sensitive to that. So vinyl or nitrile that specifically say latex free are good. So just like our face up foot massage, we can do some warm up from the knees down. And we're going to do a lot more techniques in this area in our next unit for a full body compression. So right now, this is just kind of a little bit of squeeze and press. You can see I can also rock and rotate. And some of you might notice that I'm just kind of staring off into space because sometimes I get the visual cues by like watching how they're breathing and where the movement is going. But oftentimes I feel better, palpate better, just paying attention to what I'm sensing. So when I stare off into space, I'm paying attention to what I'm sensing in my hands. But of course, if you're near a vulnerable area or you wonder how the client's responding, you can glance over, watch where your hands are, watch their breathing. And the whole time I'm pre-assessing, I'm feeling, where things are tight. So just a quick one there. Adding a little traction. And I'm going to try to keep this part of the demo pretty quick today, just to give you a little bit of sense of things you can do with the feet in the face down position. So the first thing about working with the feet in the face down position is that I think it's easier to apply. That's not what I meant to do. So we've got the support under her ankles and her foot so that we can apply more pressure. And we already checked in with the client about where that pressure is at. Now, one of the main advantages I would say of working with the feet in the prone position or the face down position is that a lot of people like a lot of pressure in their feet. And this is a nice position, to really, get your whole body mechanics behind it. I've got my joints stacked, so I'm not bending on angles. So when I'm using my soft knuckles or my fists, I've got my joints straight, my wrists straight. And so this force is actually coming from my feet, my legs, my hips, and my hips are facing the direction of the work. And doing a little warm up first. Now you can see sort of the disadvantage of this position is that you can't do as many range of motion techniques and so forth. However, if you really want to incorporate that in this position, you can lift the client's leg, and she's fully clothed. So, I'm just going to do that. But when we start Swedish massage, we'll talk about draping before we start lifting a client's leg. So what you want to do is you want to support under the leg and foot. So you slide under and you make sure you have their full weight when you pick them up. And in real time, you can go a lot faster than that. I'm just showing you how to do it in a supportive way. And then once the client's foot is in this position, you can do things like stretch them and rock them and so forth. We'll work with the calves and such later like this, but right now I just want to kind of introduce this as if you're only going to be face down and you want to get some movement. That's one way to do it. Fully support them when you bring them down. So in this position, I like to use a lot with my flat knuckles. So this part right here with my flat fists, or if I need a little more pressure with my knuckles. And you can support your hands so you don't slide, and also so you can have more strength. And you'll notice that, you know, you really can open up the foot in this position.
Is the calcaneus supposed to have a bit of movement? Like, you know, in contrast to like the leg, the ankle joint, like the end of the tibia and stuff like that?
Yes, it's good and okay for it to be able to move, but it should be aligned pretty straight. And for a lot of people, you'll see it has more of an angle in or out. And so it's okay to add some stretching to that. Yeah, when it's not lined up, or even when it is lined up. So I'm, you know, sinking in and pulling. How's that pressure so far? Would you prefer more or less? More. Great. So if you ask a client, you know, how's the pressure? A lot of times they'll just say good. But if you ask them, you know, would you prefer lighter or deeper, or differently, then they'll often be a little bit more, you know, honest or specific. And you're trying to get it just right for them, not just so that they're telling you everything is good. And then you can get into the medial side of the foot as well. And if you need even more pressure, you can even use your forearms and elbows in this position. And when you first use your forearms and elbows, you know, it's normal to feel like you don't quite have as much sensitivity, you don't know what you're doing. So you can have your other hand right there, both so that you don't slip, and also so that your other hand is being sensitive. But then you can get a lot of power with your elbow, your forearm. Now, if I don't need it to be too pointy, I can use this part of my elbow right here where it's flat. But then if there's a point that I really need to get into, all I have to do is angle my elbow more. And this is great. You know, some of you are like wanting to get into the heels more. You know, you can really get in there. I'm going to take some deep breaths and I'm going to watch the client's breaths. All right, and on that 1 to 10 scale, if 10's too deep, 1's too light, 7 is perfect. Where are we at right now? 5. Awesome. So one way to get deeper is to lift the angle. So you're decreasing the angle of your arm to use your elbow more.
You're really leaning into the table.
I am, and it's partially because the height of the client, she's way up there. A lot of your clients are going to be down here, and then you can stand back more. I'm also only 5'5". If the client's way down here, I'm going to be doing more just squats and like this, but I honestly can't reach that far that well with her way up there without like kind of getting into the table. Yeah. So, you know, you can step around the table too, so it doesn't trap you. But depending on the angle, like if I'm way up here, I can do that. But for this side of her,
you can get more pressure.
I'm kind of using the table more.
Awesome.
Yeah. And if the client is face up, you can actually ask them to scoot down or up. But right now, you know, she's enjoying the face cradle. So I got to kind of adjust with that. Yeah. So notice I'm just supporting so that my elbow's not sliding. I don't want to slide all over the place with this. Yeah.
Are you also applying pressure on your other hand to support it?
Yeah, but not as strong, but yes, I'm applying pressure here as well. And you can get pretty deep with this for a lot of clients, but just be careful, right, on those big tendons. So she's got something tight right along this longitudinal tendon or ligament, excuse me. But this is not somewhere like right on the ligament. I don't want to like full on wrestle move her, right? So I could be a little bit more precise with that issue right there. Now, I want to show you good and bad body mechanics. If I'm just being supportive and light, this is fine. But if I'm using a lot of pressure, that is too much pressure on my joint right there. So supporting her like that is fine. But if I'm using a lot of pressure, that's why I switched to a tool where my wrist is straight. And now my strength is coming from my legs, my hips, all the way down from my feet. So you don't want to hurt your wrists or even your carpal tunnels there. So a little preventative care for you. So we can do some of the sliding work in there too, because she's got a tight spot. And I'm going to go next to that longitudinal tendon. I don't want to. If you go too intensely right into it, just like when they were face up, they can cramp with that. What's that?
Yeah, that's really tight right there.
Yeah.
What's a cramp specifically? What is going on?
I mean, there's different reasons, but like if it happens when you're pressing in a massage, yeah, it's usually like really a muscle spasm. The muscle just like tightening too much. And the calves, the gastrocnemius and soleus do that pretty easily.
Is that your body kind of doing like a self-protective move, kind of?
Yeah, that's a great question. And yeah, it's sort of like that. So you have these reflexes and you have these proprioceptors that kind of give your body a somatic sense of how tight or loose something is. And it will try to like guard up and lock and protect itself, like if you go too far. So notice I'm kind of working around the area. She said it was quite intense and I don't want her to seize up. So I'm kind of easing up around it. It's still very tight in there. I could get a little more precise too. Notice how much more her foot moves. If I kind of lift her up for some of it. There is something just not happy right there. I'm gonna be a little precise with it. So the funny thing about deep tissue is it probably looked like I was doing a lot more pressure when I was leaning in with my whole body. But when she has like a really precise spot, I'm actually getting a lot more into it right now. And I think she disagreed with me. That's what I heard. Mm-hmm.
When you get into that, when you feel that spot,
Yep.
is that when you dig deep into it or you work around it?
Great question. You want to warm up the area well enough that it releases. And you also, you want to, if you're going to work into it deeply, you want to go slow and, I'm sorry, what?
It just released.
Beautiful. You want to go slow. I feel that now. You want to go, and he felt it over there. You want to go, or he's just, he's in the splash zone. You want to go slow and steady enough to give that client's body an opportunity to shift. So you don't want to be giving it a message like, release, you want to be like hanging out with it. Like, yeah, I'm here listening to you. I'm supporting you. I'm right up against, I feel you. I hear you. I see you. And then I was just hanging out with it, right? Rather than telling it what to do. And it totally released. I mean, it's in a very different place right now.
It's more of a suggestion than a demand.
Yeah, it's more like a listening. You know, like if your friend has something they really need to talk to you about, you let them talk it out, right? So you're just letting their body talk to you, and you're not telling their body what to do. Nice. And see how I'm stretching it now? Now that it had that big release, we want to kind of integrate the work, and this area has an opportunity for new expression. So we're kind of talking to it, right? We're like, oh, hey, yeah, like, hey, this bone is, we're all different in here now. How do you feel about that? And we're kind of talking to the whole picture. There we go. That's much better. I feel this up into her knee, though. There's something right there. Her knee kind of locks up right there. So that's something I would spend more time with, but in the interest of not having like a, 2-hour long demo, I'm actually going to kind of shift here directions because we have other things to demonstrate today, and just kind of show you how we would then sort of soothe and integrate this area. But in reality, if I had more time, I would work out sort of some of the neighbors a little bit. This neighbor is a little unhappy. And this one is very sensitive. This one is like not a happy neighbor. Yeah, but I said I'd move on, and so I'm going to. So I'm just going to kind of soothe this out. And this client will probably sort of feel and integrate these changes when they walk around, right? Because we're changing the possible way of them kind of experiencing their standing and walking. And you can take that all the way out to the toes. So in our first couple weeks with foot massage, we've been doing these really kind of slow and long foot massages. But a lot of times, the part of the session that you'll spend in, say, like a full body massage, unless they want a foot or a lower leg focus, you might only have like 5 minutes with the feet. So, this is, you could do as little as the first part of what I did, kind of where you just really sink in there. And a couple slow ones can be better than a lot of just really quick, like you're not getting in there, right? So you're not going to always, find all those spots and like fully work them out unless she really just wants like a foot lower leg focus. Stop that from the Zoom, please. What?
Face down massage today?
No, I'm actually going to switch right now. All right, so today we're going to work with some stones as tools. A couple days ago, you got a little bit of an introduction to that long, skinny wooden tool, which is a common reflexology tool. Not a lot of people honestly use stones, but some of you were for foot massage, unless you're doing like hot stone massage. But a lot of you were asking about, using tools if the client needs more pressure or so forth. And the stones are a great way if you do want to kind of sink into areas and make it easier on yourself. So lots of different shapes and sizes are possible. And I'm just going to demonstrate with a few where basically you want the stone to rest in your hand so that you can be really relaxed and apply pressure without gripping the stone at all. So what you don't want to use is like holding it like a pencil, because for the kind of deep work we're going to do, that's just way too much stress on your hands and the muscles, even that would like lead to like carpal tunnel or thumb issues or so forth. So with a nice tool like this, again, you're basically resting it in your hand so that you can be really relaxed, straight wrist while you apply pressure. Just a couple more variations, and really just play with stones that you find. Something that's flatter, you can do either more of the rolling kind of motions and as well as the sort of scraping kind of motions. So, and then stones are beautiful. Of course, they're each unique. Like this one here sort of has finger holds, right? So, you can play with something like that. So I'm just going to grab a couple of these and kind of play around here. And of course, every massage therapist, like what's going to work for them is also going to vary, like on their hand size. And do just a little warm up. And of course, these could get a lot more pressure. So, you know, you warm up first and you check in with the client. Yes, sir.
Would you like the oil? You said it's better to use the rocks with oil.
Oh, great question. For like a hot stone massage,
Oh,
I'm not getting so kind of sliding on the body. So this is fine. Thank you. So I'm going to rest the stone in my hand. And I have my other hand for support. And I'm feeling through the stone, much in the way of like when you use a pencil, you know, you may not be paying attention to it, but you're really not focusing on the pencil in your hand. You're actually working with the paper that you're writing on.
Oh,
They're blowing their minds, Zefire.
the metaphors are perfect.
Oh, yay.
This is how
So I actually, my body mechanics is easier like this. I'm going to twist my hand just so you can see what I'm doing. But the basic idea is that you want your, you know, your wrist straight and your hand relaxed. Now, if I really needed more pressure, you know, or, you know, I just felt like it, you could do the same thing standing and then lean with your whole body. But I'm easing into it. I don't want to jam the rock into her ligaments. I want to
using it as a firmer extension of your hand.
precisely. Yep. And you notice I can use my other hand for support, for sensitivity, in this case for stretching. So I'm being on the cautious side, but I'm going to check in on that 1 to 10 scale. If 7's perfect, 10's too deep, 1's too light. Where are we at? 7. Beautiful. And would you let me know anytime it's different than that? Thank you. So I like to ask it like a verbal contract. So they're agreeing or not agreeing. So let me know.
touch and agree. In Egypt, this is the symbol for touch and agree
Huh.
of the ancestors.
Then I soothe it out. And we'll just play with a different one. So I mentioned these flatter ones can be nice for kind of rolling precision work. So I could do like that C hold, roll on the toes. I find that when my hands are touching, I can be more grounded and more stable. If I'm floating this hand out in the air, I might kind of slip and slide. So this hand, my other hand is helping this hand. And just to move my hand out of the way, just so you can see better. And that's lovely on the toes. So here, you know, obviously this is not an area that you need to go super deep, but you can just be really more precise with a tool like this. And so you've got all these sinus and brain reflexes
Do the nerves
and
and
neck
on the
reflexes.
bottom of on the plantar side, or like is it on the tip of the toe? Like,
Nerves.
yeah, do they finish on the bottom or on the very tip?
Yeah. So we have nerves all over the place, both, you know,
Yeah.
our sensory ones, as well as, you know, the ones going to send signals. So our meridians start and end on the toes, but we have nerves all over the place.
I'm just looking at those, make my sinuses like clear up.
Beautiful. Excellent. Let's try to treat the whole class at once.
I'm a surrogate.
All right, and then at the base of the toes, we saw that lovely lomi video with the thumb at the base of the toes, and then kind of directing that breath, or she said ha. So, you could do some breath work here.
When I was giving my partner a massage yesterday on one foot, I noticed like halfway through the massage her other foot like twitch, and I feel like I just kind of noticed that on Anna too. Like, is that related? And with you too, yeah. Is that related?
Yeah, there's all these awesome relationships between the left and the right side and, brain crossing neural connections. And what I often find, and I'd be curious to hear what Elizabeth has to say on this, whether I'm working with a shoulder or a hip or a foot or really anywhere on the body, I find often that after I've worked the first side, when I come to the second side, it's already started to be worked and releases a lot faster. And I think it's from those connections. Have you seen anything like that?
I would say that that's usually the case, except for the glutes.
Oh, interesting.
They kind of do their own thing.
Yeah.
Is it true that the sacroiliac joint should move just like, let's have a little bit of movement in there?
Yes, and some people kind of move too much and some people move not enough. And it's super common for women to kind of get a little bit too much motion there, but we'll kind of get into that with hip releases and things.
In the fitness world, we
Yeah.
see this as a, what is it, posterior pelvic tilt, where your hips are more forward.
Anterior pelvic tilt
Anterior pelvic tilt.
is
right.
super common. Yep.
Right,
Yeah.
exactly.
Yeah.
And then like, for example, that tightens your quads.
Yeah.
So then
Yep.
this is the relationship between hips and,
Very common. Yep.
yeah.
Yep.
And that's the theory that corrective exercise has, that there's common like compensations that people have.
Yep.
Just based on
Yep.
current situation we're in.
Yep.
Mhm.
And we'll be adding more and more postural assessment. And as you learn more and more muscles, and I have to warn you that you will never people watch the same.
Yeah.
Anywhere you go, you'll be like seeing, kind of what's off and wanting to massage them.
Also, comic books are going to be ruined for you. Now, once you know your anatomy and comic books, you're going to see muscles that don't exist.
Oh, yeah.
So I don't know if you can tell this. There's a clicking right here. Click, click,
Ooh.
click. But I don't know. I'm going to talk out loud a little bit of what I was doing is I'm able to get very precise with this tool, and it's resting in my hand and I'm very gently supporting it like this. I'm not like gripping it really hard, but it's able to get right into the points without a ton of pressure or effort. And so what I'm doing really here is very precision work. And it was in opening up those spots that I really could start to feel this little clicking business. And we're not doctors. We don't have all the diagnostic equipment and all of that. But if I was a gambling person, I would take an educated guess that this scar tissue and surgery, is related to what's going over here on this side. And I felt a lot of kind of dryness with that clickiness. And I tend to find that the dryness is kind of when you feel that dryness, it inside in the muscles and connective tissue, it can be related to kind of older issues. There it is. There's our friend, the clicking.
I always think that like dry sensation in the muscles. Have you ever like had an orange and there's like part of the orange that's like all dry and weird, and then the rest of the orange is totally normal? It feels like that dry spot in the orange to me.
Okay, we're going to use another tool here for a different area for the heels. Something bigger like this, you could rest in the base of your hand and then use, the power from here. Are you comfortable with me holding you?
It's my knees need a little more support, like if you go higher.
That's and there. Does that feel good? Okay. If she's too, if her ankle or her calcaneus are too wobbly in this position, I'll just not lift her as much and just lift a little bit. Because I wanted to get some, yeah, see, this is just, see how it's going to absorb all the pressure. So instead, I'm just going to not lift her as far. That was a knee thing. And just sink in like so. So what technique does this look like we're doing?
With them.
Exactly. So it's the same effect as the inchworm, but we're using a tool instead of repeated with our joints. And there's a tighter spot right here.
You feel like you can have as much sensory input with the massage while you're using the tool?
I do. It takes a little practice, but we have a lot of proprioceptors. And so all my proprioceptors are still engaged with like how much give is there in an area. And also you can use your hand around it to feel what's going on.
It feels very light on the heel.
Uh-huh.
Zephyr, when you're using tools in massage like this, are you just going in without asking them if they like tools, or do you ask them permission to use these tools on their feet?
That's a great question. I ask before I do any kind of technique they're not expecting. Yep. Yep.
Yeah, because the tool is colder than her hands
Bare hands.
Thank you.
and their hands.
Yeah, and that's a good point. Thank you, client, for bringing that up. There's a lot of ways we also warm the tools. So right over there, we've got a beautiful salt warmer, and I have a little luggage suitcase thing that's a warmer. So when I do cupping or stones or whatever, I keep them warm in that. And we've got them for every station. We can even turn them on right now if you want to kind of warm up your tools. But there's these little travel suitcases that are just for warming stones and things. And it's kind of like a secret bonus that you get to learn that it's lovely to do that for the cups as well.
I never considered warming up the cup.
Oh gosh, they feel so nice.
I bet.
Yeah. All right, so I'm going to open this up a little bit. And again, you can really walk all the zones like that and apply what you already know. Just consider the areas that need more pressure. You might consider a heavier tool. And for the areas that are more precise, you might consider a smaller, more precise tool. So just as one more example, working the spine reflex right along this edge is nice to be very precise with it, getting all the way in this head and neck region. And so, you might use a little precise tool for something like that. Or if you want, kind of a medium tool. Again, we don't want to slide on the client. So that could be a matter of, do you kind of have your hands, your fingers on the skin right there to stabilize? Do you use your other hand to stabilize? And I always err on the side of caution. So I'm kind of easing in, watching the client's breath, and then I can check in. I feel like it's too light, but I don't want to have her react against what I'm doing. I don't want to ever cross. So I'm getting a little closer now. And how's that pressure on that? It feels really good. Beautiful. If you ever cross that line and they tell you it's too deep, make sure that you not only pull away right away, say you're sorry and soothe it out, rather than just make a tiny adjustment. So, you make it happy again. And then you can come back to it, but lighter. Questions about these tools? Can we stop?